So this will be the drive up to the pediatric emergency. The pediatric emergency drop-off is over here. It's back to the adult drop-off, which is just further down. So again, it's sheltered, it's underground. There's 15-minute quick parking to drive up, and then there's the parking as patients need it. This is the ambulance drive up. It's common adult emergency entrance here, pediatric emergency entrance here. Obviously heated, sheltered, not like our drive up at Tupper, where sick patients are coming in and they have to traverse the cold. The ambulance will stop right here. A nurse will be notified. She'll greet the ambulance here. Then from here, she'll decide the severity of the illness and either dispatch the patient to our red zone or to our yellow zone off the stretcher. The square footage of our ER total is double the size than what we have at Tupper right now. Patients will enter through there. They'll be greeted by a healthcare provider at pre-triage, and then quickly we'll decide if they're a green zone, yellow zone, or red zone patient. Red zone patients are those who are quite ill and need immediate attention. Yellow zone are urgent patients who probably have to come in quickly, might need a stretcher because of their illness or pain. And the green zone patients are more of the ambulatory patients, the minor fractures, minor cuts, sprains, sore throats, etc. And really the premise is as soon as a patient comes in, if we have the capacity to provide them with their single room. Here you have our green zone examining rooms. And what's different here is that the entrance, the patient entrance, is right off the waiting room. So in designing the emergency department, we tried to segregate, client-patient flow and staff flow, as you'll see inside. So we'll call the patient in, they go into the examining room, see the doctor, do what has to be done. Then they exit through the waiting room and exit the department instead of walking through the core of the department and mixing with the department operation. We have a segregated waiting area for infectious illness like measles, chickenpox, separate room for breastfeeding, which is, private and comfortable. So this is the interior of the department. This is the core. And as you see, instead of bringing the patient to the equipment, we've designed the department to bring the equipment to the patient. So we have a central core, which is where the staff will congregate, nurses, doctors, support staff. And also we have equipment that'll be stored in carts and be pulled into the room. So let's say if I have to repair a cut, in the old department, we used to bring the patient to the room where we repair the cuts. Now we'll just bring a cart with the equipment that has to glue the stitches into the room, do it in the room, and then the patient leaves. So that'll minimize footsteps for the patient and really minimize healthcare providers just moving patients around with no added value. Essentially, the other way, we dirtied 2 rooms for 1 patient, so that's a human resource issue to continually clean those rooms. Here the patient comes in and stays in their room, and it's really only 1 room that has to be cleaned, for each patient visit. This is our red zone, our red care zone. This is where we'll care for our sickest patients. And in the red zone, we have 6 treatment bays. 2 of them specifically will be dedicated for trauma. The 2 trauma bays have overhead x-ray, so built-in x-ray machines within the room.
There's your IO. That's your IO kit, okay?
I want the gun.
Yeah, the gun is there.
Gun's there?
Gun's there.
Okay.
Go for it.
The gun's there. We forgot the gun at the Tupper.
Oh, yes, so we're pretending. So the gun is in.
I'm called Blue on Sunday. Bring that gun. Okay. So the gun is there, but we can wait to see maybe if the Medaz is working.
I agree.
Okay.
Patient still seizing.
Conscientious resident, maybe
Yes.
check about the airway because the RT is asking if we have to compare anything.
Okay. So is the airway maintainable still? Baby's breathing?
Yep.
Still breathing.
In the yellow zone, we have 15 care spaces. All the care spaces have stretchers, chair for parent and families, and really in this zone, we're going to try to identify patients when they come in who will need to stay with us longer than 2 hours. So those are patients who may have a presenting illness like asthma attack, migraine headache that needs intravenous therapy, dehydrated patients. So it's really to get them into the right space, comfort, and with the team and equipment we need to care for them for the duration of their stay.